Welcome. Professional communication is critical in emergency medical services. In fact, when lives are on the line, how we communicate can be the difference between life and death. Many preventable tragedies have occurred due to poor communication, whether on scene or during handoff to the hospital. As EMTs, we communicate in many directions with dispatchers, with our partner and other responders, with patients and their families, and with hospital staff. In each case, we must be clear, calm, and professional to ensure everyone gets the right information. Communication isn't only what we say, but also how we say it. Verbal and nonverbal cues both play a role. For example, maintaining a calm, empathetic tone and body language can help soothe a frightened patient. A gentle voice and reassuring eye contact show compassion, whereas a loud, harsh tone or crossed arms might increase a patient's anxiety. Being aware of your nonverbal signals, facial expressions, gestures, posture, is just as important as choosing the right words. A patient in distress will take comfort from an EMT who appears confident and caring. We also need to be culturally sensitive. EMS professionals serve diverse communities, so respect differences in language and customs. A gesture or phrase that is normal for you might offend or confuse someone from another culture. Professionalism means adjusting your communication style to the individual patient. For instance, using simpler language or an interpreter for someone with limited English, or being mindful of personal space and eye contact based on cultural norms. By being culturally aware, we build trust and avoid misunderstandings. Throughout this presentation, we'll explore communication techniques and challenges at each phase of an EMS call. We'll cover how to communicate during dispatch, response to the scene, on scene with patients and other responders, how to relay information to medical control, and how to give a clear handoff to hospital staff. Along the way, we'll look at real world examples of poor versus effective communication, like misunderstandings on scene, interagency communication issues, and patient provider interactions, and see how they impact patient outcomes and team coordination. The goal is to learn best practices for clear, professional, and compassionate communication in any EMS situation. Now, let's start by looking at how we communicate during the different phases of an EMS response, from dispatch to arriving on scene. During an EMS call, communication needs change at each phase of the response. Different agencies or regions may have their own radio codes or protocols, but no matter the format, the key is to convey information accurately and efficiently. We'll break this down into the stages of a call: dispatch, en route to the scene, and on-scene communications, which includes both radio updates and face-to-face interactions. Dispatch communications. When a call comes in, respond to the dispatcher immediately to acknowledge you've received the call details. This typically means repeating back the location and nature of the call to confirm everything is correct. For example, if dispatch says ambulance needed at 5th and Main for a chest pain call, you might respond, Unit 5 copies, responding to 5th and Main for chest pain. This kind of closed-loop communication, repeating back the message, ensures you and dispatch are on the same page. By confirming the address and call information, you avoid misunderstandings that could send you to the wrong location or delay your response. Also, establish your dispatch time, the time you're notified, as part of your run log. This is often done automatically by the system, but you may verbally confirm Unit 5 en route at 1432, for instance. Prompt and clear dispatch communication not only sets the tone for professionalism, but also lets other responders and dispatch know help is indeed on the way. Response to the scene. After acknowledging the call, update dispatch when you start driving to the scene. Unit 5 is now en route, so they know you're on the move. While en route, keep communications concise. If you receive new information, for example, an update that the patient's condition has changed or police advise the scene isn't safe yet, acknowledge it and repeat it if needed to confirm. Upon arrival at the scene, immediately notify dispatch, Unit 5 on scene. This timestamp is important for response records and informs other units that you have arrived. Imagine if you forget to announce arrival. Dispatch might wonder if you got lost or delayed, and other responders won't know EMS is already there. A quick on-scene radio call clears that up. In some systems, dispatch may also want status updates, like any need for additional units. Communicate any such needs clearly. For instance, if you find multiple patients on scene, you might radio, Dispatch Unit 5 on scene, we have 3 patients here requesting a second ambulance. Clear updates like this ensure that adequate resources are deployed without delay. On-scene communications, radio with other responders. On scene, you'll likely interact with other first responders, firefighters, police, etc., and possibly with an incident command structure if it's a big incident. It's crucial to stay in contact and share information. Use plain language that everyone understands. Avoid agency-specific codes or jargon that others might not know. In fact, National Incident Management Guidelines require using clear text for multi-agency events because codes can vary and cause confusion. For example, instead of saying 1097 or a local code for arrival, simply say, I'm on scene, so all agencies understand. When working with teams from other services, stick to straightforward language. Share critical information with fellow responders. If you're the first EMS unit, inform others of how many patients, the severity of injuries, and any immediate needs. We have one critical patient trapped in the vehicle, starting extrication with fire department now. Likewise, listen to what police or fire personnel tell you. For instance, if the building is unsafe or if there are hazards like downed power lines, that's vital info for your safety and patient care. Good on scene communication is a two-way street. Broadcast what others need to know and absorb what others are telling you. This teamwork prevents duplication of effort and keeps everyone coordinated. For example, if you don't tell the fire crew that you've already begun patient care inside a wrecked car, they might waste time trying to do the same. Conversely, if you clearly announce, EMS is with the patient in the car, need assistance with extraction, the fire team can focus on prying open the door while you provide care, working in sync. Before leaving the scene, notify dispatch when you are ready to transport the patient. Unit 5 departing scene en route to Memorial Hospital with one patient. This lets dispatch know an ambulance is now hospital bound. Then notify dispatch upon arrival at the hospital. Finally, your last transmission after turning over care will be to clear the call. Unit 5 clear of the hospital available. Following this chain, en route, on scene, departing scene, at hospital, clear, keeps the entire system informed of your status. It may seem like a lot of radio calls, but these brief updates are critical. They ensure that at any given moment, everyone knows where the ambulance is and what phase of the call you're in. It also contributes to safety. For instance, if dispatch doesn't hear from you that you arrived at the hospital when expected, they can check on you in case of an emergency or delay. On-scene communications with patients and bystanders. On scene, it's not just radios and other responders. You'll be talking directly with patients, family members, and bystanders. This is where your interpersonal communication skills are vital. Begin by introducing yourself. Hi, I'm Name, an EMT. I'm here to help you. And explaining your actions as you go. I'm going to take your blood pressure now, etc. A calm and caring tone can do wonders to diffuse a chaotic situation. If a patient is panicking or in pain, your demeanor can influence their emotional state. Speak in a steady, reassuring voice and use the patient's name. Active listening is key here. Let the patient or witnesses tell you what happened or what their chief complaint is. Pay attention and nod or use brief responses. I understand. Okay, to show you are listening. If the patient says something unclear, gently ask follow-up questions or paraphrase their words to confirm, just to be sure I got that, you started feeling pain in your chest about an hour ago, right? This not only ensures you get accurate information, but also helps the patient feel heard and valued. Challenges and cultural sensitivity on scene. The emergency scene can be loud, hectic, and stressful. Be prepared to adapt your communication. If there are sirens, machinery, or a crowd of onlookers, you may need to move closer and speak up or find a slightly quieter area to talk to a family member. Communication barriers can also arise from language differences or cultural norms. If a patient or family member isn't fluent in English, try to find an effective way to communicate. Using simple, plain words, no complex medical jargon, is a start. You can also look for a translator, perhaps a family member who speaks both languages, or utilize translation services if available. Even basic nonverbal methods help. Point to injured areas, use hand signals, for example, motioning drink, to ask if they took any alcohol or drugs, or using fingers to rate pain on a scale. Learning a few common phrases in languages prevalent in your area can be useful. For instance, asking dolor for pain to a Spanish-speaking patient. Avoid assumptions. Don't just speak louder in English if someone doesn't understand. Volume doesn't overcome language barriers. Instead, rephrase or use tools to bridge the gap. Also be mindful of cultural differences in communication. Eye contact, for example. In some cultures, a patient might avoid eye contact out of respect or shyness, whereas an EMT might misinterpret that as the person being evasive or depressed. If a patient seems uncooperative or isn't answering questions directly, consider that there might be a cultural or language factor at play. Perhaps the patient is from a culture where it's not appropriate to discuss certain topics openly with strangers, or they defer to a family decision maker. Always approach with respect and curiosity rather than jumping to conclusions. For example, an EMT might think a patient is ignoring them because the patient won't look them in the eye. But in reality, in that patient's culture, avoiding direct eye contact is a sign of respect towards authority figures. If we recognize that, we won't take offense or assume lack of cooperation. Instead, we adjust. We might gently ask questions in a different way or involve a family elder in the conversation if appropriate. By doing so, we prevent miscommunication that could lead to errors in care. On-scene example, poor versus good. Let's bring this to life with a scenario. Scenario 1. You arrive at a house where the family only speaks a little English. The patient is clutching her abdomen in pain. The EMT asks in English what's wrong. The patient's husband just nods but looks confused. The EMT, in a rush, repeats louder, "What medicines? Any medicines?" The husband, not understanding, nods again even though he didn't grasp the question. The EMT takes that nod as an answer that there are no medicines or allergies. This could be a dangerous assumption. Maybe the patient is on important meds or has a severe allergy that wasn't communicated. Scenario 2. Now let's handle it better. The EMT notices the language barrier and switches to a simpler approach. He pantomimes taking a pill and asks, "Medicine?" The family still looks unsure, so he pulls out a translation app, or perhaps a bilingual neighbor steps in and finds the word for medicine. With a bit of effort, he learns the patient takes a remedy for ulcers. He also uses gestures to locate the pain and discovers it's in the lower right, which could be important. Appendicitis, for example. By being patient and creative in communicating, the EMT gathers critical information that would have been missed if he'd simply moved on. This patient and her family now trust the EMT more because he took the time to understand them. The scene is still hectic, but effective communication cut through the chaos and got the team the info they needed. In summary, during every phase of response, communicate promptly and clearly, confirm dispatch instructions, keep dispatch updated en route and at key milestones, use plain language with other responders, and be attentive and adaptable when talking to patients. These practices ensure that everyone, from your partner to the ER staff, stays informed, and they set the stage for a smoother, safer rescue. Now that the patient is being cared for and perhaps transported, what about communicating with medical control for additional guidance? Let's discuss that. Sometimes on a call, you'll need to contact medical control. This means speaking with a physician or designated medical authority to get advice or permission for certain treatments. This often happens while you're still on scene or en route to the hospital, especially if something in the patient's care falls outside your standing protocols. For example, you might need an order for an additional dose of medication or guidance on how to handle an unusual situation. Communicating with medical control is essentially doctor to EMT communication, usually via radio or phone patch, and it requires the same clarity and professionalism as any other critical communication. The slide reminds us that communications with medical control should be clear, concise, and accurate. File LNPTJWN as ECP9CCC7RPTSEMN2K. Let's break down what that means in practice. Clear, speak in a plain, straightforward manner, and use appropriate medical terminology that the physician will understand. This is usually not a place for layman's terms, since you and the doctor share a medical vocabulary. Avoid slang or overly casual language. Concise. Time is often short, so deliver the important facts without rambling. Accurate. Be truthful and precise in your descriptions. Before you key the mic or phone for medical control, take a second to organize your thoughts. It helps to follow a mental structure for your report, similar to the radio report format. Typically, you'd quickly state who you are and that you need medical direction, who the patient is, basic demographics, what the problem is, pertinent findings, vitals, symptoms, interventions done, and then what you are requesting. For instance, you might say, "Medical control, this is EMT Jones with City EMS Unit 3. I have a 45-year-old male with severe respiratory distress, not improving with initial treatment. His vital signs are blood pressure 150/90, heart rate 130, respiratory rate 30 with wheezing. He has a history of asthma. We've given 2 nebulizer treatments with minimal improvement. We are 10 minutes out from the hospital, requesting permission to administer epinephrine 0.3 milligrams intramuscularly. In about 20 seconds, you've conveyed the critical info and exactly what you need from the doctor." Notice that in that example, the information was organized and concise. This increases the likelihood that the physician immediately understands the situation. If instead you delivered a jumbled report, City EMS, we have a middle-aged guy here, bad asthma attack, I think. We did some treatments, but he's still bad. We're pretty far from the hospital still. Can we maybe give that shot you guys sometimes do? The doctor might be confused or need to ask a lot of follow-up questions. A disorganized approach can delay the care your patient needs. Professionalism is key when talking to medical control. Address the physician as Dr. Blank, if you know the name, or just medical control, and identify yourself clearly. Use a respectful tone. Remember, you are essentially consulting an expert for help. How you present the case can instill confidence or doubt. If you sound informed and calm, you're more likely to receive the orders you request without hassle, because the physician trusts that you have a handle on the situation. On the other hand, if you sound panicked, rude, or you give incomplete, inaccurate information, the physician might hesitate or dig deeper to verify facts, which takes extra time. Closed-loop communication with medical control is vital. This means that after the doctor gives an order or advice, repeat it back to confirm you heard it correctly. For example, if the doctor says, administer 5 milligrams of morphine IV, you should reply, copy, 5 milligrams of morphine IV. This confirmation does two things. One, it assures the physician that you understood the order, and two, it gives them a chance to correct you if you heard wrong. Imagine the doctor actually said 50 milligrams. Big difference. Closed-loop communication is a safety net to catch any miscommunication before it affects the patient. It's a practice borrowed from high-reliability fields like aviation and the military and is proven to reduce errors. Always acknowledge the instructions clearly. If something is unclear, ask for clarification. It's better to ask, Doctor, did you say 50 or 15, than to assume and make a dangerous mistake. Let's go through a quick scenario to highlight poor versus good communication with medical control. A poor example: an EMT needs guidance for a complicated case, say a pediatric seizure where the protocol isn't clear if a second dose of medication can be given. The EMT hurriedly calls medical control. EMS 10 to medical control, we have a kid seizing, gave meds but still seizing, what should we do? The doctor now has to pull information out of the EMT with questions. How old is the patient? What medication and dose did you give? What is the patient's weight? How long has this been going on? This back and forth could have been avoided with a proper initial report. The delay in communication means a delay in treatment for the child. It also doesn't instill confidence. The physician might worry the EMT is not prepared. Here is a good example. The EMT calls with a structured request, medical control, this is EMT 10. We have a 4-year-old female in status epilepticus. She's 18 kilograms. Seizure has lasted approximately 5 minutes. We administered 5 milligrams intranasal midazolam about 3 minutes ago with no cessation of seizures. Vital signs are: provide if asked or if notable. We're 15 minutes from the hospital, requesting permission to give a second dose of midazolam. The physician now has all the relevant information: patient age, weight, critical for PD's dosing, what was given and when, and the current status. The doctor can quickly decide and likely says, approved to give a second 5 milligrams of midazolam intranasal. The EMT then responds, Roger, a second 5 milligram dose in midazolam will do now. This whole exchange might take less than 30 seconds, and the treatment isn't delayed. The clear, concise communication paints a picture of a competent provider, which helps build trust with the medical control. In fact, as noted earlier, if you sound informed and organized, you are more likely to get the orders you need. The physician can tell you know what you're dealing with and will be more comfortable authorizing the intervention. In summary, when relaying information to medical control, be precise and brief in your initial report. Include all pertinent details but nothing superfluous, and state clearly what you are requesting. Then listen carefully to the physician's response, confirm the orders, and carry them out. If there's any doubt about what was said, clarify it on the spot. This clear back and forth ensures that both you and the medical control physician are on the same frequency, so to speak. Remember, you and the doctor form a team in that moment. Your communication link is what aligns field care with hospital guidance. Keeping it professional and sharp ultimately benefits your patient by getting them the right care without delay or error. After the call is over or while en route, we also need to communicate patient information to the receiving facility. Let's talk about how to effectively report medical information.